Consider wearing a mask indoors, even if you're fully vaccinated. That's the newest recommendation from the Centers for Disease Control and Prevention, which now says all individuals should mask up indoors in areas where there is substantial or high transmission of COVID-19. This comes as cases spike across the country and here in Chicago, where Lollapalooza is set to begin tomorrow. And joining us for an update on all things COVID is Dr. Robert Murphy, Director of the Institute for Global Health at Northwestern University's Feinberg School of Medicine. Dr. Murphy, welcome back to Chicago tonight.
Hey, thank you.
We didn't think we'd be having this conversation at this point in time, but here we are. COVID cases spiking in Chicago. As we mentioned, the city's averaging 185 daily cases. That's a 62% increase from just a week ago. What is driving this surge?
What's driving this surge are the unvaccinated people who were supposed to voluntarily use masks and social distancing when they were out in mixed groups in the public. And that did not happen. They just acted like all the vaccinated people. And what that's done is it's basically restarted the pandemic, and, another big wave of infections. And that's really unfortunate. The voluntary system obviously failed.
Does that mean, as we hear President Biden today talk about mask mandates or vaccination or testing mandates for federal workers, does that mean there have to be mask mandates in Chicago and Illinois again?
But it's all happening right now as we speak. The voluntary system didn't work. So we tried it, it didn't work. So what will happen now is there's going to be mandates. Mixed groups will have to wear masks indoors at least, maybe even sometimes outdoors. It really remains to be seen. It remains to be seen how bad it is. But this is, it's just this tragedy. Now, the same thing happened in India with the Delta variant. Delta is just so much more contagious compared to the other variants that have hit the United States. And, just exposure to somebody less than 1 minute puts you at risk. So that's just the big game changer here.
And the data says that the vast majority of those coming down with new infections driven by the Delta variant are unvaccinated, although we do hear reports of breakthrough cases. So how susceptible are vaccinated individuals to this Delta variant? And then how susceptible are they to spread the disease?
Well, those are good questions. So originally in the breakthrough cases, they were super mild infections with very little virus. And you heard experts around the country just say that, the vaccinated breakthrough cases are not causing really any part of this pandemic. That thinking has changed now because the thing is so highly contagious, and the amount of virus in the breakthrough cases turns out to be higher than we originally had with the other variants of concern. So this is just tragedy. Now, the good thing is for vaccinated people, we have to keep this in mind to really push these vaccines now, is they're not getting that sick. They're not ending up in the hospital. They're not ending up in the ICU, and they're not dying from COVID. Whereas the unvaccinated ones are behaving just like COVID was before, 10 to 15% in the hospital, 1 to 2% are dying. That's really what the metric is now.
But still a risk that vaccinated individuals, should they come down with COVID, could spread it. All of this, as we mentioned, happens as Lollapalooza kicks off tomorrow. I think it's been debated ad nauseum. It's going to go on. What kind of bump do you expect to see in Chicago with COVID cases as a result of this event?
Those people at Lollapalooza are from all over the United States and the world. This is going to be, a spreader event. They are requiring that people that attend Lollapalooza have a proof of vaccine. However, I don't know how thoroughly they're checking. And this was done in Europe recently at a big concert there, and over 1,000 cases were reported after a big event similar to Lollapalooza. So the question now is, how many cases are going to come out based on this one event? It's not like if it's going to happen, it's just how many.
So we don't know the exact answer to that. We have to wait and see what happens. But you're convinced that there will be some kind of bump. As we talk about all this, Pfizer has been beating the drum on recommending a third vaccine booster shot. The CDC hasn't gone that route yet. Do you think does the data show that a third shot might be necessary?
Well, what has happened is that in places that where the vaccine uptake is really good, like in Israel and in some parts of France, that the people that are getting really sick who've been vaccinated are people really at high risk. You know, they're elderly, they have underlying immunocompromised conditions, and they've done some small studies in those areas, and also here in the United States in organ transplant patients and a few other groups. And it looks like at least the antibody levels are improving if people get a booster, a third shot. Now, at some particular point, and this has been said from the beginning, that a third shot, a booster shot for everybody, is likely to come down the line. That day has not come yet. We're not seeing, once we start seeing people in the hospital again who've been fully vaccinated, then the booster's going out. It's a public health kind of nightmare. 161 million people have been vaccinated in the United States. To go tell 161 million people, oh, by the way, you need another shot. In
addition to convincing the other 161 million people to get vaccinated themselves.
We got the other 160 million people, we got to get them to take one shot, one or two shots, and then we're going to have all the ones already vaccinated. That's going to be a logistic challenge.
And on that note, though, Dr. Murphy, so that's about half the country fully vaccinated. What rate of vaccination does the country need to be at to prevent outbreaks like we're seeing right now?
Yeah. Well, we're talking about herd immunity. We don't even know what that number is. Herd immunity is difficult to calculate because you include all the people that are fully vaccinated. You also get to include some of the people who've had COVID. Remember at the beginning of this whole thing, if you had COVID, you didn't get COVID again, at least in the first couple months. Right. That turns out that kind of immunity wanes over a relatively short period of time. But they have some immunity. So you get to take those immune people and the vaccinated people, and you've got to get at least to 70, but unfortunately with the Delta variant, it's probably going to be higher than 70%, probably 80, 85%.
All right, Dr. Murphy, thank you so much for joining us, albeit under unfortunate circumstances in the country right now. Thank you.
Yeah, it's unfortunate.